go live. And we're gonna- All right, welcome everyone. Thanks so much for coming to today's wonderful webinar. We are being joined by the amazing Juvisa Rodriguez, who's going to be presenting on maternal and child health. So we're very excited you're with us today. In case you haven't had a chance to read more about today's presenter, Juvisa Rodriguez is a public health professional with over 15 years of combined experience working in academic research and nonprofit environments. For more than half of her career, she has worked exclusively at the intersection of maternal child health and health communication. She is an alumna of Iona College and Columbia University and is currently a PhD student in the Community Health and Health Policy track at CUNY Graduate School of Public Health and Health Policy. Born and raised in Washington Heights section of New York City, Juvisa credits her lived experience as a key influence in shaping her work. We are so excited to have you here today. Please, I want to hand it over to our amazing presenter.
Thank you so much. And I'm really pleased to be here. And very excited to be talking about this topic that is very near and dear to me. So I'm going to go ahead and share my slides that I have prepared for today. And, really excited to have what I hope will be inspiring and insightful conversation and presentation for everyone that's joined us today. So, as was mentioned, I have worked at the intersection of maternal infant health and health communications for quite a long time. And, it's something that I think is truly just such a passion for me. And the longer that I've done it, the more I start to see a lot of the connections from when I started my career all the way to now, and just sort of like some of the deeper connections that it has to overall health and especially the health of pregnant and birthing people. So for today, I've laid this presentation out in two sections, essentially. The first part of it will be a brief bio and just an introduction about some of my work and my lived experience and my professional journey and how I've connected the dots between all of the pieces and all of the avenues that I've essentially explored. And then I'll move on to talking about the ways in which we can tackle maternal health disparities through health communication, some of the strategies that are used, some of the approaches that I've used within my own work at my current place of employment, but also just throughout my career from the very start of it, and really sort of understanding what all of this can mean for the current state and also for future states. So a bit about me. I am what I like to use this funnel as a way of sort of introducing or explaining kind of the bits and pieces or some of the bits and pieces that I'm made up of. So I'm a first generation Latina. My parents are immigrants to this country. My mom is from El Salvador and my dad is from the Dominican Republic. So I'm bicultural and identify as Latina. And I grew up in the Washington Heights section of New York City. For those who may not be familiar, that is in northern Manhattan. And if you are at all familiar with the movie In the Heights or the musical, if you watch the musical, there are some elements, I suppose, that are very close to what the movie and the musical represent. But it was a very, impactful place to grow up. And, so much of the experience of living in Washington Heights very much informed who I am today and the path that I decided to take professionally and even through my education. So as part of my lived experience, I, was very much a witness to different determinants of health that were impacting my community. And of course, at the time, right, when you're young, you don't have those words, you don't have that terminology available to you. But it was very evident for me from a very young age that where I grew up was very different than some of the other places in New York that I would go and travel to, right? And so I spent quite a bit of time in the Upper West Side. That's the area that my mom worked in, and it was very striking to see the differences between what Uptown looked like, Uptown being Washington Heights, and what the Upper West Side looked like, and the things that were accessible. And I think that this was very much true also for the types of healthcare services that were available to us. And so I very much was observing the influences, right, that all of this was having on both individual, but also in community health. And so I kind of took that and flew with it, and I was really fortunate to have um, parents and family, but also mentors in my life that really nurtured that. And so for a while, I thought I wanted to become a physician because that was sort of like the logical thing that, you it just it's like the thing that makes the most sense sometimes for especially for children of immigrants. You're sort of taught you become a lawyer, a doctor, a nurse, a teacher, and I think that a lot of people can that may resonate with a lot of people. But once I got into college, I quickly realized that I didn't want to become a physician. I didn't really like sort of that the heaviness of the science work. And so I started to explore different things. And so it was actually in my junior year as an undergraduate student that I became introduced to public health, actually through a sociology class, funny enough. And so when I graduated, and I graduated, in 2007 from undergrad. So I was just sort of like at a loss of like, what are the next steps? And so I knew that, I was interested sort of like in global health, but I also knew that the local health, was also an issue, right? Like just even like at a state, city level was also really important to dive into. And so I was introduced to a national service program called AmeriCorps, which maybe some of you might be familiar with. Um, but if you're not, it's very similar to Peace Corps. Well, we kind of call it the Peace Corps of the US, but it sort of has the same or similar, goals, if you will. And so I did that for 2 years. I first worked in New York, in Brooklyn, in Southwest Brooklyn, and I did some community health based work. And it was incredibly impactful. I mean, it was just truly such an eye-opening experience because again, very familiar, very similar to where I grew up, but the neighborhood was very similar, but at the same time, just it just really kind of impacted me in such a different way as an adult. And so I helped manage a medication assistance program. I did a lot of community health education. And I suppose that, I could say that that's where the start of my interest in health communication started, right? Like at a very basic, developing flyers and brochures for people and posting them, around the neighborhood and things like that, like letting people know about the services available at the community clinic that I was based out of. And so then I went on, once that was done, over to work with youth at a school-based health center. And again, another sort of impactful experience. And that was sort of the introduction to reproductive health. That during that time, I really focused on reproductive health, primarily, obviously in youth, but it just opened, I think, up a door for things that I had not necessarily considered before in terms of career paths. And so once my AmeriCorps service was done, I moved on to academic research at Columbia University Medical Center. And I was there for about 6.5 years. I primarily worked in the cardiology department, have a wonderful mentor who I still keep in touch with there. And, her work was really focused on understanding disparities among women and their children. And it was very much focused on behavioral health and sort of awareness of health, like health behaviors and things like that. So knowing how to read nutrition labels and things like that. And so again, it sort of became a connect the dots sort of journey for me where I, originally have this community health experience, and then I'm, you know, doing this academic research work in my own neighborhood, actually, right? Because Columbia University Medical Center is located in Washington Heights. And so again, very impactful. And so I think that working with women and children and understanding sort of intergenerational influences around health behaviors and things like that sort of, again, open another door to wanting to go deeper into the maternal infant health or maternal child health focus. So once I, was uh, done actually with my master's, I, at the same time that I was working, moved on to do my master's. Um, at Columbia University at Teachers College, I decided, I think it's time for me to go and explore another area. And so I moved on to working at March of Dimes, where I'm actually still there. I've been there for 9 years, and I'm really focusing there on prenatal and postpartum health education. And so currently I am the senior director for consumer health there. And essentially what that role entails is overseeing the strategy, the dissemination, and the delivery of health content on both our websites in English and Spanish, our print materials, and a variety of other, avenues, if you will. And, while I was at March of Dimes a few years ago, I decided that I really wanted to pursue my PhD. And so I applied and, thankfully got in. And so now I'm a fourth year PhD student in the community health and health policy track at CUNY School of Public Health, where I'm focusing, of course, on maternal infant health. Not surprising, I suppose, the areas of interest that I, am really focusing on are around structural and social determinants of health. So things like neighborhood disinvestment and community design, food access, and housing, and what that looks like over time, and the impact that's had on women and birthing people of color and their children over time. So, as I sort of am talking, I'm thinking about, again, the connecting the dots. And so I think what I've been very fortunate to do, again, thanks to a lot of mentorship and things like that, and just really great advice from people, is that I've really leveraged my expertise in maternal health with health communication and my passion for storytelling. So outside of my professional and my educational pursuits, I'm actually a writer as well. So I do a lot of creative writing. I do photography and collage and a lot of artistic sort of, outlets. And so I, have this sort of hodgepodge of things, but it all kind of makes sense, and so these are just some of the things that I identify myself as, a public health expert and a writer and a visual storyteller. For work, it's really around health content strategy, but also a thinker and a leader. And I think that as somebody who is part of an underrepresented group in academia, in leadership spaces, it's very meaningful to me to make sure that I'm integrating all the layers of me, into my work, and hopefully to make an impact and really spark some type of change in the narrative of who a public health expert and leader is, who an academic and a scholar is, and where they come from. And so this is just a little bit of just some things that I've done as part of my creative work. I really love this author, so I wanted to, she's a poet. I wanted to put that quote in here, but this is, these two are just some projects that I worked on for one of my qualitative research classes, and just some of the writing workshops that I've been a part of. And me and my cohort mate and very dear friend actually also created a platform called the Black and Brown PhD, where we post on Instagram just sort of like our experience, being Black and brown women who are going through this very rigorous experience of being PhD students. And so I think like I take all of that and I bring all of that into my professional space as much as I can and as appropriate or as needed, right? But I find that so much of what we do is so intersectional in nature if we allow it to be, right? And so as somebody who has been working in this space for, 9 years of maternal infant health and health communication for 9 years, uh, yeah, I just think that it's super important to think in outside of the box, and really sort of think about not just what the problem is, but how people who are on the receiving end, who are the ones experiencing this, like these disparities, like how are they thinking and what are they experiencing and what are their stories? And so I do think that it really allows for me to again just sort of be a bit of an outside of the box thinker. And so, that kind of brings me to the real, at the core, right, of today's presentation, which is health communication for maternal health equity. And, really what I wanted to focus on here is one, talking about the importance of understanding our audience's needs. And an audience can be a lot of different things, right? It could be, people that are maybe you're talking, if you work in health communications, to one specific group of people, or maybe it's the group of people plus the people that are part of the support network, right? And so for birthing, individuals, that can either be, a loved one, a partner, a whole, network of amazing family and friends. It looks different to a lot of people, but just understanding the needs and who's coming to access this information is super duper important, right? And so then the second part of that is really talking a little bit about the strategy and planning for effective content and what that really looks like and the things that need to be considered when creating materials. And I use the word content, but really it could be materials, it could be I say content because it's web content primarily that I'm overseeing. But it can look a lot of different ways. It could be a brochure, it could be any number of things. And then the third part of it is really considering the impact of the current and, future state, but like considering the impact of the information that you're delivering or the materials or the education that you're equipping people with. Consider that impact and also the possibilities for the future, right? Um, and so I'll talk a little bit about March of Dimes and the work that we do. So it's for those who may not be familiar, it's a maternal child health organization that has been around for quite a long time, actually, since 1938. And the original mission and vision of March of Dimes was to help pioneer research on polio. At the time, that was a very big issue. It was a very big scare for the United States, and it was impacting a lot of people. But as many things are in public health and just in health in general, things pivot, we have to pivot, we change. And so I think that March of Dimes has been great in doing that, right? Decade after decade, and just really sort of staying on like just staying abreast of what's happening, right? To their audience, which is moms and their families, really, or birthing people and their families, and the impact that would be had on babies and their families. And so essentially they pivoted, from polio to then birth defects to promoting healthy pregnancies. There was a very big role that March of Dimes played in raising awareness about the importance of folic acid, which is essential for helping reduce the risk and actually preventing neural tube defects in babies very early on in pregnancy. And so then pivoting again, right, to preterm birth. And so today I'd say that a lot of the focus of the work that we're doing is really centered around maternal mortality and severe maternal morbidity. Lots of layers underneath that, right? But really at the core, that's essentially the key focus, if you will. And some of the notable publications that you may or may not be familiar with are the March of Dimes report card, which is published every year and actually provides insight to preterm birth rates across the different states, and actually looks at it from a county or city level, and grades each of these states with either anywhere from an A through an F, and really kind of helps paint a picture of the state of maternal health when it comes to preterm birth and the things that are impacting preterm birth. And then we also have the maternity care desert report. We actually just published the 2024 report in September, and it was, just incredibly striking to see some of the data that our Peristats data team found, which I'll be sharing with you all today. And the maternity care desert report, what the focus of that is to talk about areas within the US that have literally maternity care deserts where there is no single obstetric clinician available to the people living there. And so I have some visuals that I wanted to share actually, but before I, get into that, I wanted to talk a little bit more about consumer education at March of Dimes and what that really looks like and what the strategy is, and why it all matters, especially when we consider things like preterm birth and the report card and how, each of these states are graded and the pictures that are painted for that. And even the maternity care desert report, and how all of this really intersects and really overlaps with each other. So at March of Dimes, I, think that I really focus in on plain language, and I talk about plain language until I am blue in the face. I mean, truly, it is something that I think uh is just so essential anytime that you're writing health communication materials, whether they're online, on social media, on a piece of paper, in a brochure, on a flyer, like it does, even when you're speaking, right? And so plain language really has some fundamental key sort of pillars that you need to follow, right? And so when you're writing it, it really allows us to understand, don't overwhelm the reader with a bunch of bullet points that they're not going to understand. Don't use medical jargon, try and find the most plain way. If, instead of saying hypertension, you can say high blood pressure. Just being mindful of some of these just like more like technical terms, but also language that may not be necessarily understood by someone, and especially somebody that maybe it's not so much about limited literacy or inability to read as much as it might be limited English proficiency, right? So much of the information that's available to us, thankfully now it is available in multiple language, but that's not the case for a lot of things, and not everybody is doing that. And then the other approach that is very much applied to the work being done at March of Dimes and the consumer ed work there is this idea of transcreation and translation, or transcreation over translation, right? And so the nice thing about March of Dimes is that we have a Spanish language website that has all of the articles that we have on our English language website. And it's really neat because it's a standalone website. It doesn't toggle between languages. It is literally like its own website, and all of those articles have been checked and written by an actual human. With the rise of AI, sometimes that can be tricky, but it's just it was something that was created to really, I think, meet the needs, right, in the best way of Spanish speaking people or people who prefer to read and speak Spanish, right? And so really like the philosophy behind both the English and the Spanish website and any consumer education that's developed at March of Dimes, it really boils down to three things that I'm, again, very passionate about. It's to educate, it's to equip, and it's to empower. And, I'm really probably more so like a big advocate about equipping and empowering and using those words because a lot of people are educated, when it comes to health literacy has sometimes nothing to do with your level of education. It has everything to do with, your ability to process and to just kind of like apply that information. So there are people that may have higher education that they're very educated, but it's just about equipping them and empowering them in a way that is in plain language. It's transcreated in information, but that they can feel very much like that they have agency, and that they can go into an appointment and feel like that they can have that they're part of a shared decision making process, right? And so that's really the philosophy that's applied. And I work very closely with the marketing and communications department at March of Dimes to really sort of engage people through social marketing strategies and things like that. And they do that through different social media platforms. Um, so I wanted to sort of circle back to the maternity care desert report and just show you a visual of what does this actually mean, right? So this map on this very large map here is maternity care access designation by county in the US and also in Puerto Rico. And so what we're seeing here is that the pink areas are the areas that have been identified as maternity care deserts. So some things for us to keep in mind, right? Um, this report is showing that 1 in every 25 obstetric units, or rather amplifying the fact that 1 in every 25 obstetric units in the US closed in the last 2 years. And it's actually also telling us that even though, it's sort of like overwhelming sometimes to even think like, how can this be possible? But actually 35% of US counties are actually considered maternity care deserts. So in over 1,000 counties in the US, there's actually no single obstetric clinician or birthing facility. And when we think about how does this impact uh, people, and maybe not just birthing people, but people of reproductive age, and women who are potentially planning, or to get pregnant or have the desire to, or could get pregnant, right? And what does that look like? So that's actually more than 2.3 million women of reproductive age live in a maternity care desert. And so here on this side, we have the island of Puerto Rico, which we do some, we do have like an office there, and we have amazing staff there. And so these areas in red are the maternity care deserts that have been identified in Puerto Rico. So, pretty striking, I think, to just kind of like be made aware of, right? Um, and so here, this slide is again taking our maternity care desert, findings, and like I said, over 35% of U.S. counties are maternity care deserts. And then I wanted to show what that looks like compared to this map on the bottom, which is a health literacy data map that the University of North Carolina, Chapel Hill put together. It isn't a bit of an old map. It's from 2014, but I think it's very striking nonetheless. And on the right side here, we have another map, and this map is the Connect to Health FCC Task Force's Mapping Broadband Health in America. And I'll kind of talk a little bit about each of these and what all of this means, shortly. But I did want to mention that all of this is really sort of, I think, just it kind of like aligns so well because October is actually health literacy month. And so I think that having this discussion is very timely, right? So, like I said, the bottom map here is showing us health literacy across the US. And essentially the red, or like the dark, the red and the orange are some of the areas that have the lowest health literacy levels. So some facts for us to sort of think about and noodle on is that health literacy impacts nearly, a lot of people, and nearly 9 out of 10 adults in the United States struggle with health literacy. The other thing that I think is really important to point out is that about 60% of Medicaid recipients have been found to have either below basic or basic health literacy levels. And that's compared to just about a quarter of people who have employer-based or employer-sponsored health care coverage. And so, like I said, with this health literacy map, the data is actually from 2003, but the map was created in 2014. And the reason for that is because the only national data that is available for health literacy is from the National Assessment of Adult Literacy, and it was actually conducted by the Department of Education. There is a lot of other ways to measure health literacy, like individual health literacy. There's assessments and other techniques, but when we're talking about it from a national standpoint, this is the most robust sort of representation I think that exists. There have been other efforts, and other sources for measuring health literacy, but they're not really, I would say, measuring the same things in the same way, right? And so the reason why all of this is important, right? We see these maternity care deserts where people are lacking, right, access to a very important healthcare service. We are seeing this health literacy situation happening over here, and we also know that the state of maternal health in the United States is abysmal. And we are also understanding that it's impacting people from racial and ethnic minority groups at a much greater rate. We are no stranger to seeing these headlines about the impact had on Black women, the impact that's been had on American Indian and Alaska Native women, the impact that's being had on Hispanic and Latina women, right? And so I think it's really important to understand that there are multiple research studies and assessments that have been done that are showing, this sort of connection between health literacy and other health disparities. And, I want to also say that a lot of the issues that we're seeing in the US with regard to maternal health care are not exclusive, right, to health literacy. We know also that it's a very fragmented healthcare system, a lot of, issues with structural and systemic racism that have really fueled and fed a lot of this, the outcomes that we're seeing today and that we continue to see. It's still happening, right? But I do think that at the same time, it's really important to elevate this connection, if you will, when it comes to health literacy and maternity care and disparities, among within the maternal infant health space. And so, on this side over here, we have this map, and it's mapping broadband health in America. And so what this map is showing here is that it's showing you the areas that are designated maternity care deserts and the availability of broadband connection. So if you live in an area where there is a lot of purple, or like in a section of the US where there's purple, it means that there's a double burden. And what that means is that not only do you live in a maternity care desert, but your access to broadband connection, for Wi-Fi and things like that, right, is limited. And so that's a double burden. That's what these folks have identified as a double burden. And the blue areas are where there's opportunity, to adjust or, essentially, I guess, address, this issue in a very effective and efficient way. And so this Connect to Health Task Force platform was actually something that came about when the Data Mapping to Save Moms' Lives Act was signed into law. And that happened in 2022. And so that law is directing the FCC to incorporate publicly available data on maternal mortality and severe maternal morbidity. That includes actually 1 year postpartum into the platform, so that they can map, what does broadband health and access look like, and what do, these outcomes look like, and how do these come together. And so this is in consultation with the Centers for Disease Control and Prevention. And so I think that there's just a partnership happening there. And so really, when we talk about connecting the dots and, what does this mean for health equity? What does this mean for maternal health disparities? What does this mean for health literacy? How can my organization do better, if you work in a maternal infant health space, like how can you all connect the dots? And so I think that there's, a lot of ways to do that, but I think remembering the difference between personal health literacy, but also organizational health literacy. Because yes, this map is showing us individuals who are impacted by health literacy, individuals who are impacted by maternity care deserts, and individuals who are living in areas, right, where maternity care deserts and this broadband connection issue exists. And of course, there's always the goal is to help alleviate, a gap, when it comes, something like personal health literacy, which really at the essence, at the core, right, it's the skills that you need to be able to participate in the healthcare system and be able to maintain good health. But when we think about health literacy from an organizational standpoint, and this is something that I bring to my own organization in conversation and discussions with leadership and my colleagues, right? The reality is that we have to also pivot and think about how, as an organization, are we meeting the needs, and providing equitable access to information that could really be very much life-saving, right? If you are in a maternity care desert or you have to travel very far, to get your medical care. And, again, here's my storytelling and my creative or sort of like thinking outside of the box. I'm somebody living in one of these pink areas, and I am pregnant and I am experiencing symptoms that don't feel like that they're normal. And I have to drive, like, and I have to go and drive many miles to go see my provider. And maybe I don't live in an area where broadband is an issue. I go and I look for information about the symptoms, and I can equip and empower myself to ask the questions to my provider and to understand what the warning signs are of something more serious versus something that might be just a discomfort, right? Like, and sort of allow people to have information at their fingertips in a way that can really change, the outcome of something, right? Or maybe it could be that they're not aware of a symptom and they're dismissing it and, just sort of like go on. And then we hear about, really terrible things and really terrible outcomes. So what are we as an organization doing, to ensure that we are really meeting the standards of organizational health literacy? And organizational health literacy really at the core of it is it's the degree to which organizations equitably enable individuals to find, to understand information and to use that information when it comes to their health related decisions, right? And so how are we doing that at March of Dimes? These are some of the projects that I've been, very, very just ecstatic to be a part of. We've really tried to pivot a lot from text heavy things to things that have more visuals to engage people, because sometimes when you are someone who is looking up information about a symptom or something that, you are concerned about, having a lot of text is really overwhelming. Sometimes we can't, sometimes we have to meet in the middle. And so, it's always a work in progress. But this here is an infographic on postpartum depression and other mental health challenges, and just sort of talking a little bit about some of the changes in feelings and changes in everyday life that may, come about from the postpartum period. One of the things that I think is also really crucial and important to do, and kind of goes back to that whole point of transcreation and really developing culturally competent uh, materials, if you will, is that some people identify some people may be depressed and may not exhibit some of these symptoms. And so maybe it looks like a stomach ache. Maybe it looks like not feeling myself, you know? And so using language like that to really kind of, again, equip and empower and educate folks to understand, right, their health and to make these shared health decisions with their provider. We also have a really neat partnership with CVS Health Foundation, where we are amplifying the importance of doulas and the work that they do. And again, just informing people about, you know, who is a doula, what are the benefits of having one, why should I hire a doula, and what to know about them. And, you know, for anyone who may not be familiar with the literature, some of the findings, doulas, there's been a big movement to really make people more aware of the power of having a doula, because it's somebody who is there for you during the birthing process, maybe even a little bit before, and then maybe even a little bit after. But really sort of the power of a doula can really change the outcome of a delivery and birth in many positive ways. Reduction in C-section rates, you know, just having a more pleasant birthing experience for some. And one of the most recent projects that we launched is low dose big benefits. And this one is making folks aware of the impact and you know, benefits of low dose aspirin if you are someone who is experiencing or rather has the risk factors for developing preeclampsia, which is a very dangerous condition that can lead to severe maternal morbidity or even death. And so the way that we offer these pieces are, again, through print and digital offerings through our March of Dimes catalog, and that's really more for providers and clinicians and things like that. We also have an app that we launched and are in the process of updating and really sort of elevating more within the spaces. And you know, we have a platform called It Starts with Mom that allows us to engage corporate partners with some of the work that we're doing. And then again, we have our two websites, the Spanish one, nacersano.org, and then marchofdimes.org. But we also do this not just online, right? But we also have NICU family support sites, and we have an incredible NICU team that is based in different hospitals. We have NICU coordinators and things like that that provide support to people who have been impacted by preterm birth or have a either shorter or longer NICU stay with their baby. We also have mobile health units, and we use QR codes and print materials to you know, get people informed of you know, the content that we have. And then we also have a lot of local events, and a lot of our maternal infant health directors are part of that. And so, you know, looking to the future state, right? Some of the focus areas, and again, I mentioned, you know, the CVS Health Foundation partnership and our low dose aspirin awareness campaign. We've done a lot of work with the CDC around congenital health conditions at birth, and as well as postpartum mental health as it connects to the congenital health conditions at birth. And I think that, like, as I think to the future, and I connect the dots, you know, to all of these things. Three of the areas that I hope to move into more into 2025 is really leaning into this FCC maternal health and broadband data. I think it's really incredibly insightful. Really utilize and leverage health literacy maps and data visualizations. And really explore more of what Healthy People 2030 is, you know, really trying to get us all to become more aware of, which one is, you know, one of the things I think is super important is organizational literacy. But there's also a national action plan to improve health literacy. And it has 7 goals that are connected to health literacy and strategies for achieving them. I want to be mindful of time, so I won't be able to go into that too much, but definitely something to take a look at if you are somebody who either works in the space or, you know, you collaborate with people that work within the health literacy, health communications space, in regardless of what specific audience that you are working with. So I think that is it for me, and I really am so thankful for your time and very much happy to answer any questions that um, I tried not to look at the chat too much, but I do see quite a bit in there. So thank you so much for your time and attention.
So, Javisa, I just want to thank you. What an amazing presentation. It's obviously you work at the Center of Health Communications with that stellar talk, and you've been getting a lot of love in the chat and
Oh,
lots of
great.
hearts coming up on the screen and claps. Um, there are a few questions here, if you don't mind, if we go through some of them.
Sure.
So the first one is would it be possible to get a shareable version of your slides? Some
Oh,
folks
absolutely.
folks always
Yeah,
ask about that.
more than happy
Wonderful.
to. Yeah.
Um, and we have like an international sort of group here today, so very exciting. Um, so first up, based on just based on your talk, what are and thinking of like social political sort of events that have like an impact on maternal and child health.
Mhm.
Obviously we're going through something right now.
Yeah.
um what are some of the most pressing sort of issues around MCH that you see kind of bubbling up to the surface now, and also down the road, if you want to prognosticate just a little bit?
Sure, yeah. I would definitely say the focus on maternal mental health conditions is one. It's something that we, haven't necessarily been so great at talking about very openly. I think it's unfortunately such a taboo topic for a lot of people who may be experiencing it. But I'm happy to see that there's a lot more effort happening around that. And I think that when, considering that we are in a political, like a very interesting political environment and election season being around the corner, it creates a lot of stress. There was a really interesting research that was done back in 2016 that actually showed that the rate of preterm birth increased during the Trump election of 2016.
Oh my
And
goodness.
yeah, it was really very impactful. And so, I can't remember off the top of my head, like some of the key things, but I know that part of it was alluding to the stress, right? The sociopolitical stress, and the nature of, the things that were being said and shared, during that time. So definitely like the correlation between that and the mental health, piece. But there's a lot of, work from a political side, a lot of Congress people working a lot on just moving forward on different acts and things like that that are specific to maternal, infant health.
Mhm.
So yeah, and I think it's really important to talk about them and weave them in to your health communications in the best way that you see fit, right? Not overburden people with so much of the jargon because sometimes it can make it worse, right? Like the stress could be made worse by
Yeah.
reading about certain things. So.
You raise so many good points. And a lot of times we think of historical events occurring in a vacuum, but
Mhm.
they impact our how impact health outcomes just as much as any other social determinant of health. So what a fascinating data you shared just there. And just thinking about this point in your presentation, like where you were, this idea of being able to share information, like related to things like that, in a very clear, concise way. And you showed some beautiful flyers. Someone asked, Amy Abushanab asked about, if there was any pointers on a checklist of best practices for creating such resources. She mentioned that she was trying to train staff on using these techniques, but not sure where to start, if there was any specific trainings. I mentioned if like maybe I assume maybe at March of Dimes you're working with the comms division. It's that you have that maybe outsources design or does it in-house.
Mhm.
But I didn't know if you knew of like any Canva templates that might be best to use, or just where my folks might start.
Canva's great. I love it. And especially if you're an under-resourced nonprofit space or organization, definitely such a great tool. We definitely have a very talented and robust Marcom team, and they're great. Believe it or not, I'm actually the one that talks to them a lot about plain language. So I train the Marcom people, around that, because what I've noticed is that like marketing communications and then health education folks and health communications folks who come from a public health background, we
Mhm.
speak the same language, just a different dialect. That's how I like to
That's so
explain it.
funny.
And so I oftentimes, it's very much like Spanish. I mean, as a half Dominican, half Salvadorian, I cannot tell you how much of a world of a difference that is, right? Like in terms of Spanish terms. But I'm the one that actually, will talk and train to our staff. So Amy, if you are interested in talking more, please, Amy or any other folks on the chat today, I'm very much happy to, chat offline, and, I'm available on LinkedIn, so you can certainly, message me. And I'm happy to also actually, with the slides, provide a short document of resources and things like that that might be helpful to people, because it can be very overwhelming to kind of figure out which one of these things kind of, would work. But there are some really neat, and of course I can't think of the top of my head, but I have like a whole tab. So I'm happy to share those with folks.
Oh, that's wonderful. That'd be wonderful. Some folks have been really excited about getting the slides. So, I guess we have another, if you have time for just a few more questions. Uh, Someone asked, what will be future correlations with the doula initiative in terms of improving service delivery, as well as impacting positively on maternal and child health?
Yeah, that's a great question. I think that there will be quite a bit that will come out of this. For one, with doulas, it's unfortunate because within the maternal infant health space, I think there's a lot of silos that exist. And so there's like doulas, and then there's midwives or folks who practice midwifery to whatever extent, right? And then there's like your traditionally trained medical providers like OBGYNs, right? And so sometimes, again, same language, but like different dialects, if you will. And so sometimes I think that there has been a challenge to integrate doulas into the healthcare system, because sometimes people, even professionals, don't understand what they do exactly, right?
Mm,
But I do think that there's a lot of powerful data showing that the rate of C-sections, feeling empowered and supported, even like the need for pain medication gets reduced when you have a doula present, and when you're supported. And the New York City Department of Health actually had a really great or has a really great initiative, and they actually publish something called the State of the Doula Report every year, I think from like 2018 or 2019 up until pretty recent. And they've integrated, access to a doula for Medicaid recipients, and people who are at risk, for encountering some of these adverse outcomes. So the evidence is very much there. I mean, it even has been shown to help increase engagement with breastfeeding, for example, that a
mm,
lot of people want to do, but they don't always have the opportunity to do. So quite a bit there. From a March of Dimes standpoint, I think as a national leader in this space, we have an opportunity to really educate and equip people, professionals included, right, with a better understanding of like the pivotal role. Because the way that I see it, and I think a lot of people within maternal infant health see it, is that it's not like just one provider that should be doing all these things. It's like
mhm.
it takes a whole unit, of care, really. And so I think it'll help really kind of like just change the way that like the systems of care are. And there are challenges to doula, work, right? Like a lot of times it's not covered by insurance. There's more, say, states expanding coverage via Medicaid, but there's a lot of like, also red tape and bureaucracy and things that occur, where especially around equitable pay for doulas, right, reimbursement rates and things like that. So that is like the downside of it. But I think everything, it's like one step at a time. And so I think just by even like raising awareness, as a national nonprofit, it's I think it can really be impactful. So
Well, that was a really insightful question. Thank you very much for sharing. We had some more inquiries asking, you're very popular. Folks want to stay in touch with you. I
Yes.
shared your profile page on
Right.
bcph.org because, as you know, our guest speaker today was one of our 40 under 40. And I think that's apparent from her talk. Um, but also just wanting to just maybe we have time for one more question.
Yeah.
Um,
And I
I
shared
guess,
my email in there as well if folks want to reach out, as well. So,
yes, wonderful. And I guess um, you mentioned some things about data sources and how like there's very limited sort of understanding and research around health literacy. And I knew that at one time Kaiser Family Foundation was doing this type of work, and you mentioned you pulled your data from Department of Education. But I just know if you wanted to talk about data sources and maybe best practices around doing this type of research when it comes to data and where you're pulling it from.
yeah, so the map with the health literacy map, that one was from the University of North Carolina, Chapel Hill. Unfortunately, the National Assessment for Health Literacies, the data is so old. And so in my ideal world, what I would love to do is advocate for any one of these organizations, big government organizations to assess it again, like where are we 20 years later, over 20 years later, especially with the rise of social media platforms. What was true in 2003 is not really necessarily true in 2024, right? And so what does like I just think about all the misinformation also that swirls around in spaces like TikTok and Instagram and Facebook, and all of that. And so how does that maybe potentially feed? And I think that as a PhD student and as somebody that is going down this, research and academic path, I'm excited to maybe potentially like open up, the conversation about what does this look like? How can we measure health literacy in different ways from a national standpoint? I think it's really important to make sure that, when you're piecing together your data, that it's coming from sources that are like really explaining what that actually means. So you can't necessarily go to an assessment tool that's used, right, like at a clinic or something like that to kind of generalize that all the people within that area, must be having the same issue when it comes to health literacy. That may not necessarily be true, right? So, but I think that that's striking. And this, the data about the 60% of Medicaid recipients having below basic or basic health literacy comes from the Center for Healthcare Strategies. And I found that that one was a very good resource, in preparing for today's conversation. So,
No, well, thank you for sharing those insights. When it comes to doing like any type of research, it starts with that data, right? If you don't have it, it doesn't,
yeah,
it's just conjecture. Um, and it also helps answer that question about so what, like being able to pull the information and see how different populations are impacted. That's a part of public health. And you so clearly delineated that, you made your argument and then you backed it up with data. So knowing where to go for that backup is just so helpful.
yeah.
um, yeah. So just coming down, thank you so much for sharing your email with folks. And I don't know if folks joined right when we were getting started, but Javisa and I are both at Columbia. So it was kind of like old home week.
Yeah.
So well, I I can't believe that it's been like an hour, but it just flew by. I just want to thank our speaker again today for this amazing talk. I put in the chat BCPH supports new and emerging thought leaders like Javisa and like you, and we want to be here for you. Everyone who comes to these talks is given special access to a membership option. We have the elite membership. If you go on our website, it's has an annual price associated with it. But if you order through the link that we've provided here, and I'll put it in the chat again, it is $175, but it's for 3 years. So it works out to $4.86 a month over a 3-year period. And you get to apply to 40 under 40, like Javisa and other awards that we have. We have new options available. So if you have any questions about that, you can contact us at communications@bcph.org. And then in the chat as well is our membership link for those who come to our webinars. We thank you again, Javisa, for this amazing talk, and invite folks to contact you directly. And they can also contact communications@bcph.org if they need any help after today. And of course, everyone who attended receives a certificate of completion for today.
Wonderful.
So thank you again.
Thank you. Thank you, everyone. And, we'll be in touch because we have our Columbia connection. So
yes. And so yes. And also I work in, it really is Old Home Week talking with you and hearing all of your amazing work.
Yeah.
So, okay.
Thank you. Have a great day.
Bye-bye.
Bye.
Bye, everybody. Be well. Oh, there's one last question here. Oh, thank you very much. Someone said, okay.
Thank you all.